Good afternoon. Good afternoon. Thank you for joining us for our first prevention exchange of 2024. We'll give folks just a second to get connected. If you're like me, you're wondering what happened to the first 24 days of 2024. But here we are, and we are so excited to be talking with you this afternoon. My name is Jen Morell, and I have the honor is serving as the Managing Director for the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. And before I turn our session over to our esteemed facilitator and presenters, I just wanted to welcome you to the space. Thank you for joining us for our conversation about affinity groups as a consideration for workforce inclusion. And then we'll delve into a deeper conversation about how the center and some of our partners have utilized this concept to create inclusive spaces for learning. But before we get there, for those of you who may be joining us for the first time, I just wanted to share a little bit of information about the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. At the end of today's session, I'll have a slide where you can subscribe to our newsletter if you're not already receiving it. But essentially, we strive to serve as a one-stop shop to be a central access point for prevention science in Ohio. And that looks like that means a lot of different things to a lot of different folks. But essentially, we are looking to institutionalize those core components of behavioral health prevention and promotion across a variety of practices, initiatives. We know there's a lot of folks who identify as prevention professionals, and then there's a lot of folks who are interested because the topic and prevention spans multiple disciplines. So we want to make sure that everybody who works in prevention has access to that, the prevention science. And we also want to become a central access point for Ohio's prevention professionals and interested others as you look to develop your skills, your attitudes, and your knowledge base about prevention science, because we know the science is always expanding and prevention is so much more than substance use disorder. So without further ado, I'm going to introduce our esteemed facilitator, Dr. Tessa Miracle with the Pacific Institute for Research and Evaluation. Tessa, thanks so much for taking the wheel here.
Absolutely. Good afternoon, everyone. Thank you so much for joining us today. I have the pleasure of facilitating with Mr. Albert Gay today. So we want to first talk a little bit before I hand it over. I'm going to talk a little bit about what is an affinity group. So I think we've all likely heard this term at some point, especially in the last couple of years. I feel like it's gained a lot of momentum. And when we're talking about an affinity group in this space, we're talking about a group of individuals who are linked by a common purpose or ideology or interest. So, I know I personally have conducted or supported affinity groups for individuals who identify as Appalachian or individuals who are from rural areas. As we look at the impact of affinity groups, the true purpose of an affinity group is to support equity. And it also is one of the groups that are one of the focuses is to support creating an inclusive environment, supporting an inclusive environment, and identifying systemic barriers or needs within a system that we live in, we teach in, we learn in, or maybe that we work in. So affinity groups are maybe something we've seen as a more novel concept, but there's something that has a deep-rooted history in research and evaluation. For the purpose of this training that we're going to talk about today, we are going to talk about the importance of affinity groups in learning and professional development. We're going to understand the unique supports that were offered by Ohio's BIPOC PST affinity group. Oh gosh, I used a bunch of acronyms there. So we're talking about an initiative that was supported by the Ohio Center of Excellence involving our She Raise colleagues as well as our UMADOT partners throughout the state of Ohio. So The Ohio BIPOC PST training is Ohio's prevention skills training, modified from the SAPS, which does use stigmatizing language in their names. So we wanted to say PST. BIPOC is referring for Black, Indigenous, or people of color, recognizing that we have our own way of identifying ourselves. So that acronym it supports a larger group of individuals. And then we're going to talk about how this novel training has impacted Ohio's workforce. So we want to look at, what are the impacts? What is meaningful here? This training was developed and co-created with our partners throughout the state. It was developed in response to data that was analyzed regarding the number of credentialed prevention specialists in the state, and looking at some of those demographics of who is a prevention specialist, who's a prevention consultant, and who do we want to support on this journey? What additional supports might folks need in order to make the system work for them? So I'm going to hand this over to my colleague, Mr. Albert Kay. I know Albert is going to be sharing some slides with us today, so we might do a little do-si-do here. So we might have Jen stop sharing, Albert start sharing, whatever works for you guys. I am in a unique space here where I unfortunately am computerless. So I am facilitating from a different setup today. So I am relying heavily on Jen, Albert, and Elika. So please feel free to put things in the chat if something isn't exactly like you'd like, and we'll make sure that it gets addressed. So Albert, I'm going to let you share your brief introduction and a little bit about some of the background of this work.
Hey, will do. Thank you, Dr. Tessa Miracle. Thank you, Jen. Good afternoon, everyone. I'm Albert Gay. So good to be here from Charades and Associates. Good to see a lot of you all on there. One of the things that I love to do is politely ask if there are those who are there that are off camera, if they'd be willing to join those like Mary, both Marys, she and myself. And if you wouldn't mind, you don't have to. Hey, I get it. Sometimes it's not that type of day, but if it is that type or could be that type of day, I do love faces because faces help us connect in ways that are beyond the virtual walls and barriers that we have. It allows us to see, and you all know the majority of communication is not is not verbal. Majority is always nonverbals. Hey, Shemaine, good to see you. That's my birthday, almost my birthday twin coming up there. So good to see you all. Thanks, Mia. Thanks, Beverly. Jackie, I appreciate you. Marissa, thanks so much. And so we're going to go ahead and allow you all to experience kind of what we've been experiencing in our BIPOC affinity group. And so I want to share my screen and you all should be able to see that. Is that correct? You see my screen? Thumbs up. Excellent. Thanks for the thumbs up. See, I'm already with the visual, I'm already benefiting from it. So thank you for throwing the thumbs up, everyone. Just want to talk about that. I am appreciative of all of those that have allowed us and helped us to bring this to fruition. Starting off, of course, with Charades and Associates. We want to thank the OCAM network, Ohio University, UMADOPS, and Ohio Center of Excellence, and of course, Ohio Moss. Where would we be without all of you all and all those who have participated so far in our affinity groups? We have all learned and grown together. So I'm going to take a little breath and breathe with you all because a lot of the things that we do in our affinity groups, we slow it down, right? And I cannot speak enough about slowing down to the pace of your participants who are representing the communities in which you're serving. And that's one of the great learning and continual learning factors in conducting these affinity groups has been so long people are dictated to top down. We got this training. You learn this training, you learn it at our pace. We only got an hour and a half, or an hour, or 2 hours, or however many days. And so it doesn't allow people to breathe. And so affinity groups already begin to allow us to breathe. And that breath is so important. And so if you can see here on my slide, I've got these stone structures. I like these stone structures because they allow us to see from different perspectives. They may all seem the same, but there's diversity amongst each one of these groupings, even within the grouping. So even within the affinity group, we're looking at diversity. And so it's one of those things that I love about nature. There's no two leaves that are alike. How many of y'all agree with that? Coming from the same tree, year after year, the tree is producing thousands of trees yearly. And yet, no matter what year, you can take a leaf from currently and compare it to the leaves that fell, 100 years ago from that tree, and you still will find that not one of those leaves are the same. And so I think the great learning in this affinity group is that we immediately start to realize what brought us together under a certain title, but also within that, just the breadth and the width and the height of diversity within it. And so I want to thank all those that appreciate diversity and the strength that comes from it. And so with that, let's talk a little bit more about affinity groups. Thank you, Dr. Miracle, for sharing earlier about affinity groups. These groups are communities of people who come together based off of some shared identities and interests and experiences, whether it's race or ethnicity, gender, religion, or sexuality. Affinity groups offer space for people to, my favorite word, connect. Connect with others, share those experiences, and also in that, together create community. And that is, if I could say the word magic, that is where the magic is with affinity groups. If you want to see people come together and create a community from, even though they're brought together by a shared identity, still they may not know each other, or they do know each other, but as they are communicating with each other in a safe space, they begin to build an entirely different community with those individuals whom they may have had relationships with. And then they realize that there's so many levels deeper that they had the opportunity to go with before, but this space allowed them to actually build it together. And so that's what affinity groups help do. And I like that. I want to talk to you all about this and give you a little taste of what it is. Before we do that, I want to talk about the purpose of an affinity group. We want to create safe spaces. We want to encourage you all in this little demonstration that you'll have an opportunity to maybe offer support or encouragement or empowerment. And also, we want you to be able to see how you can build platforms from this new grouping, how you all might take care of each other as in a microcosm of a community that we create with this activity. How's everybody sound with that? If we create a little activity where you all had an opportunity to experience an affinity group, would you all be okay with that? All right, so here it is. We're going to break you all into groups if you, should you choose to, and I hate to say the word break. We're going to allow you to choose a room. What's it like working in the field of prevention or other field of profession from this identity? And so there's going to be 3 opportunities, and we wish we could have more, but the 3 are female. What's it like working in prevention or other profession from that identity as female, or male, or if you're non-binary, what's it like working in a profession as a non-binary person? So we're going to allow those 3 rooms to open up, and when you enter that room, we want you to just begin to share, begin to talk about, think about, reflect. And we ask that you all would give each other courtesy and allow each other to express without judgment. And then want you to respond from your place. What's it like for you?
Absolutely. Thank you so much, Albert. As you can probably see on your screen, I've just opened up your virtual breakout room. So you can select, the first one is I identify as a man or male. The second is I identify as a woman or female. And the third is I don't identify with either one of those labels. Like, let me have another room here. So we are going to set our timer. From the appearance, I don't want to assume, but from the appearance of names and faces, I am making a small assumption that one of our rooms will be a little bit larger than the other rooms, and that's great. So we're going to add a little bit of extra time onto this discussion to make sure that you can hear everyone's voice, make sure that there is a space that's meaningful for you. So as a reminder, your breakout rooms are not recorded. So you are welcome to be free with your self-expression, be free with your language, whatever is meaningful for you. I will broadcast when you have about a minute left and let you know that that is coming up on you. But I think we're going to give you maybe 8 minutes to try to get through this. If we see those microphones still lighting up at 8 minutes in and it seems really boisterous, we'll add more time and broadcast that for you. But we're going to go ahead and set that timer. We're going to let you join those rooms now. We'll stay in the main room. If you have any questions, we're going to pause the recording at this time, and we will start that recording again when you come back out. So I hope you have a wonderful breakout room. Again, your question is, what's it like working in the prevention field or other profession with this identity? What's it like working in this field with your gender identity? All right, we'll see you in just a little bit. Wonderful. Thank you guys so much for coming back together so well. We can see those microphones lighting up, and I hope that you really enjoyed the discussion. I'd love to hear from you. What were some themes that emerged from your discussion?
I'll start off and then I'll pass it on to Mary, Jeannie, and uh, both Marys. So what we started off talking about is coming into prevention. When we first started in the field, it was a lot just women, and just to piggyback off of what Mary Wolf said, and maybe we feel like it was because of that nurturing role, the planning role, the ones who are involved in making things happen. We really saw where, just how societal roles is now with women taking, being responsible for a lot. We've seen that early on in prevention, but we are excited about the shift that we're seeing. Mary Francis brought up about, when she first started, I'm not going to say the year, but Nettie Ferguson being the first person and her mentor and being the only really woman of color, and how that has changed over the years as well. And how as women, we be excited to see men in the room, and we're noticing that more, and we're like, yes, we need you. So those are just some of the conversations that we had in the female breakout room.
Oh, I love that. Thank you. Yeah, this idea of, it's expected that we're nurturing, that we're providing the caretaking, maybe even some of that hidden labor that we see in workplaces. Absolutely. Were there any other themes that emerged? Well, it sounds like you were really you covered it all, Shemaine. If there were other themes that emerged, and maybe you're I know I personally sometimes when the dogs are barking don't want to unmute. So if there's anything like that, you can add it to the chat. But after this experience, we want to hear from you. How was it being able to talk with a group with a similar background? What were some of the nuances that you noticed? Were you able perhaps to get to the subject matter more quickly because you didn't have to explain the nuance? What was it like for you?
Well, well, from our group, it was a connection, and it is and it was a connection. It was, yes, a familiarity about it. We started in this from a female perspective. We've grown in that area. We've been prepared for that kind of role. And so, yes, and we could see changes and fluctuations in that role and in that kind of work as we go forward. So we was able to, identify that and relate to it. So that's what I felt when I was in the room. We're familiar with this role and this work, and we can see, growth and change.
Absolutely. Absolutely. And I thank you for that, there is an understanding of the historical perspective as well as, where things are now without having to talk and take a deep dive on some of that. And I see that Mary Frances shared in the chat, it felt positive as there was head nodding and building on each other's comments and experiences. So this idea of yes, and this other piece. Do you feel, after sitting through this, do you feel a little you feel you understand how an affinity group could be more meaningful than when we originally came into this space?
One of the things, one of the things that I found from being in an affinity group is that you kind of think you know what that group is about, but then you find so many diverse layers, and even though you may occupy that particular role, it may manifest differently in a different age group, culture. So it's layered
Yeah.
kinds of surprises as you go forth, and interests and skill. So, I think it brings us together, but then you get into the in-depthness of it, and it's like, wow.
Yeah,
This is great.
absolutely. Like, oh my goodness, there's so many more facets to
Yes.
our experiences. We may have some things shared, but there might be this other piece that you can teach me about, or I can teach you. Absolutely. I love that. Thank you for bringing that forward.
And I think too that, what my experience has been in affinity groups is it's kind of nice when that initial feeling of, okay, I'm not the only one out here hanging out here by myself, struggling, trying to go, and you can share, you can become vulnerable enough to then, hey, here's what I'm struggling with. And 9 times out of 10, there's going to be somebody in that affinity group with either a supportive statement or perhaps an ability to help you see or reframe what you're saying for yourself so that you can then, oh, okay, I never thought about it that way. Or I had this incident happen. What could I have done differently? Or, but it's done in that with that psychological safety that we all need. Because without that, trying to make change for any of us is just so hard. It is just not an easy thing to do. So that's why, to me, affinity groups are almost invaluable.
Oh, thank you, Mary. That's so important. I love that you brought up safety. The idea of feeling like I can show up with my whole self. There's no part of myself I need to leave outside this room because it's not safe here. So thank you for that. I want to thank you all for sharing your thoughts and comments. We can keep this going in the thread, but I really don't want to delay any further hearing from Albert. We're going to take a deeper dive into Ohio's BIPOC Affinity Group work, how this was meaningful, or well, how it was created, how it was meaningful for Ohio's prevention workforce, some of the themes that emerged through this work. I'm going to let Albert take over. I'm going to stop talking and just hand the floor to him.
Yeah, thank you so much for leading that discussion, Dr. Miracle, because you all were able to experience a taste of it in this session here. Mary, as well as others, have already had that great experience of having affinity groups. We wanted to give a taste here and how many times those discussions are led by the group members. So you all led your own discussion, and then when you came back, you're still in that affinity group mindset. And you also had it where you were able to see it from the facilitated side, where Dr. Miracle led you all through a series of questions for the purpose of having an objective to reach, right? So there's the spontaneity, the uniqueness of each individual able to contribute from where they are authentically, where their location is. And also, we're able to move as a group by directed questions that are designed to prod and also to spur for deeper conversations towards a goal. And so I want to thank you, Dr. Miracle, for doing that. Thank you all for participating in that. Um, you all created that safe space. And with that, we also had in mind for affinity groups, just as we can see the benefit from that small exercise, how that could be beneficial to our entire field. And so what we wanted to do was develop it to help our workforce build capacity to move them towards certification in the state of Ohio. We've had the opportunity to see people who were not on a track as far as credentialing, becoming certified, to now they were able to get great connections to OCAM, where OCAM comes in or around our day one or our day two. Sometimes it might be another day, depending. That person comes and talks and shares. We had the lovely and great Takia come and share about the route towards that certification, that credentialing, and what steps people needed to take. And that allowed a bridge where a person may have had a gap from a space of, hey, I don't know how to get there, or barriers. It now in that affinity group made it easier, and not only easier from a perspective of there was a support group around to help and cheerlead you towards that certification. So it actually became a thing where people were able to sit down with, for our case, we have the great Dr. Marquita Robinson, who's over the Dayton UMADOP, and she was able to help guide people through and tell them next steps and show them the paperwork and let them know some of the things that are challenging and how to also circumvent those challenges. So we've already seen that people are beginning to apply and increase the workforce from a standpoint of those from the Black community, BIPOC communities of Ohio. And so that was really a goal, and it was great to see it. I want to talk about how we connect the affinity group with the research that comes from what you all may remember as the SAPS, which now has a new name, but they removed the stigma of abuse. It used to be known as Substance Abuse Prevention Skills Training. Now it's the SPIF application something. Just trust me. So what we did was we did this, and I love this. We with the SAPs, we have concepts, research, and case studies, which we now kindly refer to as PST. That's what's here on the left side. What we do is we do a lot of bridging. And so from the concepts that we learned from prevention field, we let you all and let them see the cultural relevance that pertains to those concepts. We also, where there's research, we talk about it also from a standpoint of discovery, right? Of what's going on in our communities and this uniqueness that may not have been in the framers' minds who came up and developed the original SAPS curriculums and programs. So we do a lot of that. And then where there's case studies, we relate that to experiences that they've had. And so we call that bridging. It has been a great opportunity for people to ask questions in pace of where they are and where their communities are. And so if there are concepts that we need to slow down on, we slow down on them. And then we talk them through until there's a kind of a mutual mile marker that's achieved, to which the group says, okay, we're ready to go on. We've got this concept. We've seen that time and time again after the 5 that we've had there in the state of Ohio. So just some anchors that we like to have as far as our BIPOC portion, Black, Indigenous, people of color. Here's some of the words that we anchor in throughout our time together. And as you can see, there are some words that kind of stand out. And just real quickly, I like interactivity. What are some words that stand out to you? If you all wouldn't mind populating that in the chat, I'd love to see what words resonate with individuals. So what words from these anchors are something that would pique your interest and say, yeah, I want to talk more about that, or learn more about that, or share my experiences more about that. So I'm looking forward to that chat as you all are populating those love chats. All right, so let's see what we got here. Strategies, vulnerability, history, equity, ethics, power, equity, capacity. Beautiful. I love that. Thank you all for that. I appreciate you doing that. That allows some contributions early on. This is something that we actually do with those that are in the group. Trauma, as one of the last ones mentioned, we definitely go over, because BIPOC populations of color have experienced a unique traumatic experience here. And that ties into everything that we're doing. So we, in our background, and thank you, Beverly, and justice. So that's another matter that we cover as well. A lot of times these experiences bring people together, but also there aren't opportunities in their regular trainings or regular prevention sessions in which those topics would come up. And so we like to validate right off the bat. Beverly, we right from day one, we want to, when you come in that room, we want them to know we hear, we're willing to hear more, right? Imagine you come in and none of this is ever discussed or talked about in a training. And we're talking about your community and the people you're serving, along with the groups that you identify with. And we never talk about it, right? And so then you go to the next training and it's, Mary, it's never talked about, never discussed. And then they go to the next training, Jackie, and guess what? It's never talked about. It's never discussed. And so in the field, these things, do you all think that these things have a tremendous impact on them as an individual and their communities that they serve? And imagine you're never able to talk about the elephant in the room, right? That has impacted communities for generations. And we go, no, we don't see that. And so we want to, day one, let people know we see these things, and we'll have discussions about it, and we'll be able to apply it to prevention in our field. So I love that. So kind of the background, that's kind of the background of things. So yes, we talk about substance use and misuse. We talk about the impact on their communities, health and behavioral health disparities. We go through that. We go through equity. We talk about equity, and we love talking about this image and what the boxes mean, right? Because these boxes have meanings. And we go through what those boxes mean, right? So that there's little or less confusion. When we talk about health equity, we jump into it and talk about why those health equities, health equities or inequities within the systems exist. That they form either access or blockages in systems. So we talk about those systems. And then, of course, like I mentioned, we talk about justice right alongside prevention. And when we have this great slide which shows definition of prevention, definition of public health, definition of equity, and a definition of justice. And you can clearly see when they're all together how they don't detract from one another, but how they all can have threads that run through them. And so all those threads equal outcomes. And I love prevention. Prevention is all about outcomes. You know what else is all about outcomes? Public health. Equity is an outcome, right? It's wanting an outcome in which people achieve their what? Full health potential. And justice is all about removing barriers that prevent people from achieving their full health potential. And those barriers are often the same environmentally: social disadvantage, economic disadvantage, and environmental disadvantage. And those disadvantages don't even have to be there. So we talk about that and how those all link together. In that, we talk about harm, because substance use has caused tremendous harm in all communities, but we're coming together as an affinity group. So we talk about the harm that's resulted within BIPOC populations and communities. And so we talk about that harm, but we talk about the origin of that harm. Where does that harm stem from? Substance use in and of itself is a harm, it's a fruit. It's not the root of the harm, right? So we like to get to root cause and root cause analysis. What is the root cause? And so when we're trying to chase this, right, to find out, why do we have this as an outcome? And so we start to go down. And as we're going down and go deeper, we use a method, which we call the root pathways. How many of y'all have heard of the 5 whys? All right. Well, I would like to show a video right now. And I hope you all can hear it. Let me reshare. Hold on, because I don't think I clicked that little button. How many of y'all know what little button I'm talking about?
Thank you, Albert. And we have just want to double check in case there are any troubles sharing. We can also send this out to attendees afterwards. We have about 11 minutes left.
Okay. Yep. This is about a 3-minute video. Everybody ready?
You okay?
All right. So, how many of y'all enjoyed that video? That is my favorite video. I do. I love the music that goes along with it. That video is great. And what it taught us, there's so many lessons in there. But how that applies to us is that when we're talking about substance use, to answer why, right? And you start going to the whys, and one of the pathways of those whys, if you don't ask why, it's so expensive dealing with the top issue, which was, oh, well, if we want to stop this, then we're going to have to move the airport. They're talking about DCA, the Reagan Airport. How many of y'all are flying into DCA on Sunday because you're going to Samsa Day and CACA? Yeah, just think that was under serious consideration of being moved, right? And all they would have done was realize after moving it that they were still having to hardcore clean, right? So that tells us a very important lesson with our communities in BIPOC is to go to the 5 whys or keep asking why till you get to the root. So we go all the way to the root. We go to historical context. And as a result of learning the history around, substance use in this nation, as well as discriminatory practices, how those things end up resulting and manifesting even today because we never dealt with the intent and the impact, the original intent and the original impact. And that original intent and impact has some resulting consequences, left cracks in many of our communities that we consider BIPOC, Black, Indigenous, people of color. And so when we don't talk about things and we don't get to the root, we end up coming up with just the top layer reasons why things are happening in those communities, which usually involves a lot of stigma, a lot of things that aren't necessarily true, but people assign meaning to things when they don't have a historical context. So we know it's important to go back in order to share why their communities look the way they do, right? For the purposes of not just complaining, but for the purposes of understanding what's been built on top of cracks, right? Question: if you had a house and you were going to build a new house and you saw there was a crack in the foundation, how many of y'all would continue to build on top anyway? Let me see those hands. Come on, come on. Right. Logically, it doesn't make sense. I want you all to know that's exactly what has happened, is that instead of stopping and saying, hey, these things happened in the past, let's not just stop building right now. Let's go back and repair the harm that resulted as a result of that impact. And then we would build a stronger what? Building construction on top of it. And so the resulting consequence has been there's still the crack. You can still see it. That crack is still there because it was never properly what? Repaired. And so therefore, in our affinity group, we center on healing. And we center on healing, I like to call it slow healing. We heal slowly because what we found is in affinity groups, people for the first time are able to open up about issues they've always known about, but never in a professional setting been able to talk about. And therefore, they've been building their prevention and their substance use programs, prevention programs on top of huge cracks, as though these prevention programs by themselves were enough to bring healing. How many of you all know that is not the case? Evidence-based is great, but evidence-based may not address the totality of what those communities are facing. So we heal at the level and the rate of the community and those that are represented in the allyship. We heal by decoding like the matrix. We decode the 8 dimensions of wellness and the social determinants of health. We define healing, right? I love 8 dimensions of health, 8 dimensions of wellness and the social determinants of health, because they allow us to unlock our communities, and we begin to decode everything by barriers or access to these 5 areas, and also where they are individually in terms of 8 dimensions of wellness. And so this becomes a huge thing that we do throughout our days in our affinity group, is defining everything through the social determinants of health, which gets to the root reasons of why their communities are suffering from the things they're suffering from. We also explore power so that we can use power to go back and begin to rectify the barriers or the inequities within the systems that cause a shortage to any number of those social determinants of health. Power is so important. And then we begin also to discuss restoration, and why restoration of communities begins at repairing those cracks within the foundation. We have a public health response. We know that they can't do it by themselves. So in our affinity group, we encourage and support coming together and partnering and collaborating with health in mind and achieving what we call the blue sky, which is what is the ultimate dream that you have for your community, and how with things like the strategic prevention framework and discussing of inequities and planning to bring equity to their communities, they can reach that blue sky. And so we've had 5 opportunities. We've done Dayton, Columbus, Lima,
Cleveland.
Cleveland, thank you. And
Mansfield.
Mansfield, thank you. And so they're even able to connect afterwards through our virtual meeting sessions, as well as something we call connectivity space. And so as an outcome, I'll leave you with this testimony. I hope you can hear it. This is from Pam, one of our
Let me ask the question. Okay. Hi. Please tell us your name and what you do, and tell us about your experience here with the BIPOC prevention skills training here in Cleveland.
Hi, my name is Pamela Hubbard. I'm the founder and executive director of Golden Ciphers Youth Development and Cultural Arts Center. This training is exceptional. I've been certified for over 20 years, Ohio Certified Prevention Consultant. I've never experienced the information that I'm gaining this week, and be able to use it and just take it off the papers and implement it. We've already started collaborating within this training, so I'm very grateful. Thank you so much.
Thank you, Ms. Pam. Appreciate you. Let me ask the question.
So that's it. Just wanted to end on that note. I know we're a minute over. I apologize. Tessa, I apologize.
It's very important. So thank you so much. And thank you so much for sharing your experience and your knowledge and your energy with us today. This was absolutely wonderful to hear from you guys. I know that you may need to jump to your next meeting. You may have your agenda is set for the day. I do welcome folks to stay with any questions that you may have. I know, Jen, that you have some quick wrap up. So what we could do is Jen go through her evaluation and then welcome folks to stay after with some questions. If you don't have time to stay and ask a question, I completely understand. You're welcome to put that into the chat. You're welcome to email. We will make sure that any needs you have are met. But I really want to thank all of you for your time and your energy today. It was really wonderful to learn with you about this work, and I am so excited to see where it goes. A year from now, we'll be hearing even more updates.
Perfect. Thank you so much, Tessa. Thank you, Albert. Thank you, everybody, for joining us. Real quick, if you're not signed up to receive our newsletter, please scan that QR code and we'll follow up with the link to the video as well. Albert, lots of love on that video, so thanks for sharing that with us. If you would also take a minute to tell us what you think about today's session. I know Albert would appreciate it as respect to the presenter, the Prevention Exchange Planning team. We use it to plan future sessions. And then my last plug would be, if you like what you heard today, you might be interested in checking out our recently released podcast, where we talk about the difference, promoting behavioral health equity through accountable spaces. And our guest on for that discussion is amazing. With that said, I'm going to go ahead and wrap up and wish you all a wonderful day. And thank you for giving us an extra 3 minutes of your time. And we'll look forward to seeing you at the end of February for our next edition of Prevention Exchange.
Thanks, everyone. Appreciate you all.
Thank you. Have a great day.
Have a great day, everyone.